Adult hearing loss has several causes. Certainly the most common is called presbycusis. It's the type of hearing loss that we develop as we age. The hearing nerve loses its sensitivity as we age, starting in the highest frequencies, and the older we get, the more it develops into those lower frequencies. Sometimes hearing loss in adults comes from noise exposure, and there's a very classic pattern that we can see on a hearing test that tells us this is a noise-induced type of hearing loss. Those two are far and away the most common nerve reasons for adults to have hearing loss. Some medicines can contribute to hearing loss. There's chemotherapy agents, high-dose antibiotics. Those patients generally have had some kind of warning that those medications make their hearing at risk, and they're aware of changes during those treatments and will come to the office with concerns. But far and away, the most common reason is the nerve loss that we get as we age. All of these nerve-related hearing losses, treatment is only hearing aids and amplification. Some hearing loss in adults is what's called conductive. The sound can't reach the hearing nerve. The eardrum or the bones of hearing aren't moving the way that they're supposed to. They have scar from surgery or old infections. They have damage to their eardrum from an injury. Something's mechanically wrong. And some of those can be treated surgically. If we can correct that mechanical loss, we can bring the hearing up to as good as the nerve can hear. But the nerve loss, the only treatment is amplification with hearing aids. And the only way to know is to have a comprehensive audiologic evaluation with an audiologist. A really important type of hearing loss that people should be aware of, much more common in adults than in children, is sudden hearing loss. We like to tell patients that we think that this is from potentially a viral insult to the hearing nerve, similar to the way that patients develop Bell's palsy, that sudden weakness of their face. We think that a nerve of hearing gets attacked by a similar type of virus. The more quickly we find out about sudden hearing loss, a change that happens over hours to days, the more quickly we find out about that, the better chance we have of getting that back. Treatment options for that are steroids mostly. Of course, finding out what type of hearing loss is there is the most important. So a good exam that tells us there's wax or not, there's fluid or not, and then an audiologic evaluation that confirms this is a nerve loss or this is a conductive loss. And then as quickly as we can find out about it, then we would like to get people treated on or started on treatment so that then we best chance of getting that hearing back. One thing that I really warn, especially adult patients about who come in for, I'm having hearing loss, they get diagnosed with this presbycusis or noise-induced hearing loss, and I'll say to them, you should expect for that to be a gradual change. If ever you have a sudden worsening of your hearing, we need to know about that right away. Can we treat it? Can we get rid of that sudden loss, bring you back up to baseline by getting rid of wax or finding that you have fluid? But it's this nerve loss we really worry about. Best chance of getting that back is seeing you quickly and getting treatment started right away. Tinnitus is noise that a person perceives that isn't there. Some people ringing, commonly ringing, buzzing, roaring, any noise that your brain is hearing that other people aren't perceiving from the environment is tinnitus. It's very common. 60 million Americans have this noise in their ears. Very commonly, it's associated with hearing loss. Generally, in aging, high-frequency hearing loss occurs first, and that's why people perceive high-frequency hearing. I hear this loud, high-frequency noise in my ear when there isn't sound around me. That is a symptom of hearing loss. It's rarely a symptom of an underlying medical problem. It generally is a symptom of age-induced or noise-induced hearing loss. Patients often ask us, am I ready for hearing aids? And that's really something that only a patient can tell us. How is your hearing loss affecting your life? Are you not participating in clubs you used to go to? Do you no longer play cards with your friends? You can't go to a party or out to dinner because you can't understand the conversation. The background noise is so intrusive that it interrupts your conversation. You can't hear your spouse from the other room. These are the things that we say, it's time to think about. You know how this is affecting your life. This is very quality of life.